Ever wonder why that burning sensation in your chest just won't go away? Could it be acid reflux affecting your daily life? Acid reflux, also known as gastroesophageal reflux disease or GERD, is a common condition where stomach acid or bile flows up into your esophagus, causing irritation. This can lead to that unpleasant burning feeling in your chest, often after eating. Acid reflux is more than just a nuisance. It's a prevalent issue that affects millions worldwide. When left unmanaged, it can cause serious complications, including damage to the esophagus and an increased risk of esophageal cancer. But here's the good news: acid reflux is typically manageable with the right strategies. By understanding this condition and how it affects your body, you can take steps to alleviate its symptoms and protect your health. Discovering strategies to manage acid reflux can significantly improve your quality of life. So let's delve deeper into this topic and explore how to stop acid reflux from ruling your days. Recognizing the symptoms is the first step towards managing acid reflux. The symptoms of acid reflux can range from mildly annoying to severely disruptive, but they all point to the same underlying issue: the backflow of stomach acid into the esophagus. Let's talk about some of the most common symptoms you might experience if you're dealing with acid reflux. One of the hallmark signs of acid reflux is heartburn, a burning sensation in your chest, often right behind your breastbone. It's a discomfort that can feel like a fiery discomfort that seems to be rising from your stomach to your neck. Another symptom you might experience is chest pain. This pain can sometimes be sharp and sudden, leading some people to mistake it for heart-related issues. It's always important to seek immediate medical attention if you're experiencing chest pain, just to rule out any heart conditions. Difficulty swallowing, or the feeling of having a lump in your throat, is another symptom that people with acid reflux often report. This symptom, known as dysphagia, can make it feel as though food is sticking in your throat or chest after you eat. You might also experience a sour or bitter taste in your mouth due to stomach acid backing up into your throat or mouth. This is often worse when bending over, lying down, or after eating. If you're frequently experiencing these symptoms, particularly more than twice a week, you could be dealing with a more serious condition known as gastroesophageal reflux disease, or GERD for short. GERD is a chronic form of acid reflux that can lead to complications if left untreated. Now, it's important to note that while these symptoms are common, they're not exhaustive. Acid reflux can present differently in different people, so if you're experiencing other discomforts that you think might be related to acid reflux, it's always a good idea to consult with a healthcare professional. Understanding these symptoms will help you identify acid reflux and take appropriate action. Believe it or not, simple lifestyle changes can make a huge difference in managing acid reflux. Let's dive into some of these strategies. Firstly, maintaining a healthy weight is crucial. Excess pounds can put pressure on your abdomen, pushing up your stomach and causing acid to back up into your esophagus. If you're overweight, work towards shedding those extra pounds through a balanced diet and regular exercise. Every little bit counts. Now let's talk about our diet. Certain foods and drinks can trigger symptoms of acid reflux. Common culprits include spicy foods, fatty foods, citrus fruits, tomatoes, chocolate, mint, garlic, onions, and caffeinated or carbonated drinks. While it's not necessary to completely eliminate these from your diet, try to consume them in moderation and observe if reducing intake has a positive effect on your symptoms. Another important strategy is to eat smaller meals. Large meals fill up your stomach and can cause the contents to press harder against your esophageal sphincter. That's the muscle that keeps stomach acid from going up into your esophagus. So, instead of 3 big meals, consider having 5 or 6 smaller meals throughout the day. Lastly, avoid lying down soon after eating. When you're in a horizontal position, it's easier for stomach acid to creep up into your esophagus. Try to stay upright for at least 3 hours after a meal. If you're prone to nighttime acid reflux, you might even consider elevating the head of your bed or sleeping in a slightly upright position. Remember, implementing these changes doesn't mean you'll never experience acid reflux again, but they can significantly reduce the frequency and severity of your symptoms. And it's not about making all these changes overnight. Start small, maybe by adjusting your meal sizes or avoiding that late-night snack. These lifestyle changes might seem small, but they can have a big impact on your acid reflux. So give them a try and see the difference they can make in your life. Sometimes, lifestyle changes aren't enough. Over-the-counter medications can provide additional relief. When you've tried all the lifestyle adjustments and dietary changes, but those pesky acid reflux symptoms still persist, it might be time to consider over-the-counter medications. These can help control acid production and alleviate discomfort, but always remember, they should only be used as directed by a healthcare professional. First up on our list are antacids. These are the most common over-the-counter treatments for acid reflux. They work by neutralizing stomach acid and can provide quick relief for occasional heartburn. Antacids come in many forms, from chewable tablets to liquids, so you can choose the one that suits you best. Next, we have H2 blockers. They work a little differently. Instead of neutralizing the acid, they reduce the amount of acid your stomach produces. This means they can provide longer-lasting relief than antacids, but might take a bit longer to kick in. If you find yourself reaching for antacids more often than not, an H2 blocker might be a good option for you. Lastly, we have proton pump inhibitors, or PPIs. These are the heavy hitters in the world of over-the-counter acid reflux medications. PPIs block the enzyme in the stomach wall that produces acid, lowering the amount of acid your stomach makes. They can provide relief for both occasional and frequent heartburn. However, they're not intended for immediate relief and may take a few days to start working. While these medications can provide relief, it's important to remember that they're not a cure-all. They're there to help manage your symptoms, not to eliminate them entirely. And as with any medication, there can be side effects. These can range from minor ones like headaches and nausea to more serious ones like kidney problems and bone fractures. That's why it's so crucial to talk to your healthcare provider before starting any new medication regimen. They can help you weigh the benefits and risks and guide you in choosing the right treatment for your specific condition and lifestyle. Remember, always consult with your healthcare provider before starting any new medication regimen. Despite your best efforts, there may come a time when you need to seek medical attention for your acid reflux. It's vital to understand that while lifestyle changes and over-the-counter medications can be effective, they may not always be enough. And that's okay. It's why medical professionals are there, to step in when you need them. So, how do you know when it's time to reach out to a healthcare provider? Let's delve into some telltale signs. Firstly, persistent symptoms. If you're experiencing heartburn, regurgitation, or other symptoms of acid reflux more than twice a week, despite making lifestyle changes and using over-the-counter medications, it's time to consult a doctor. Persistent symptoms could indicate a more serious condition known as gastroesophageal reflux disease, or GERD. Secondly, difficulty swallowing. This could be a sign of esophagitis, an inflammation of the esophagus, or even esophageal stricture, a narrowing of the esophagus due to scar tissue. Both conditions are often caused by prolonged exposure to stomach acid and require medical intervention. Thirdly, unintended weight loss. If you're losing weight without trying, it could be a sign of a serious health condition. Acid reflux can cause loss of appetite or make eating painful, leading to weight loss. Finally, if you notice black stools or vomiting blood, seek medical attention immediately. These are signs of gastrointestinal bleeding, a potentially life-threatening condition that needs immediate medical attention. Remember, it's always better to be safe than sorry. Acid reflux can be more than just discomforting. It can lead to serious health complications if left untreated. So if you're experiencing any of these signs, don't delay. Reach out to a healthcare provider. Knowledge is power, and being aware of these signs can help you take the necessary steps towards a healthier, more comfortable life. You don't have to live with the discomfort of acid reflux. There are resources and treatments available, and it starts with recognizing when it's time to seek help. Don't hesitate to seek medical attention if your symptoms persist or worsen. Managing acid reflux involves understanding the symptoms, making lifestyle changes, using over-the-counter medications when necessary, and seeking medical attention when needed. This balance is crucial in maintaining your digestive health and overall well-being. Let's quickly recap. Recognize the symptoms of acid reflux, such as heartburn, regurgitation, and bloating. Muster the courage to make lifestyle changes. Manage your diet, lose weight if necessary, and reconsider your sleep habits. Over-the-counter medications can provide relief, but they're not a long-term solution. They can help suppress stomach acid production, neutralize the acid, or protect the lining of your esophagus. However, if symptoms persist or become more severe, don't hesitate to seek medical attention. Your healthcare provider can offer additional treatments or interventions, or even rule out more serious conditions. Remember, it's your body. Take control, make informed decisions, and live a life free of acid reflux discomfort.